So hi everyone, I'm Cassandra from DASSA. I started in October working on the Give Up Smokes campaign, so I've come to just tell you about the work that I've been doing on the campaign and just a bit of background on it. So it's part of a Tackling Smoking initiative implemented by Drug and Alcohol Services South Australia to reduce smoking prevalence among South Australian Aboriginal people. It adopts evidence-based approach to delivering culturally targeted health promotion messaging on smoking-related harms and support for smoking cessation. The campaign was launched in 2011 as part of SA Health's 4-year implementation plan for addressing at a state level the COAG's National Partnership Agreement on Closing the Gap. The current campaign funding is until June. So it comprises of paid advertising, campaign-specific resources and community partnerships, and out-of-home advertising, such as bus shelter, shopping centre, and digital media. The next slide. The campaign targets Aboriginal smokers 18 to 39 years in the Adelaide metropolitan area, and it's the primary target audience is adult smokers who are parents and carers and other adult smokers aged 18 to 39, with a secondary target audience of Aboriginal children 10 to 14. Previous campaign messaging has included fight the habit, you don't need smokes, quitting smoking is a journey, think quit, and the current campaign is quit smoking and live for the moments, which is about fleeting interactions with loved ones that are looked back on treasured. Moments such as these can strongly be linked with regret, particularly if smokers have missed out because of health-related issues. Next slide. So we focus tested 3 concepts, and there's threat and inspirational, and the inspirational was looked upon more favourably and drew attentions of smokers. The feedback was that it was a simple message, highly relatable, and carried a positive tone, and promoted family unity and longevity, and reflected importance of children and parenthood. And overall, it was the best due to the visually high contrast, emotionally positive, and some participants said that it affected them to the degree that they would feel guilty or not smoke around the concept. Next slide. So the campaign images are representative. So the Give Up Smokes campaign is an important component of a suite of evidence-based tobacco control strategies implemented by SA Health to reduce smoking prevalence. It encourages Aboriginal smokers to quit smoking and directs them to the Give Up Smoke site. Here, smokers can find information and tools to help quit, and links through to the Quit counselling services and the My Quit Buddy app. Next slide. So there's 2 marketing components of the social marketing campaign. So there's outdoor, where we engage with a media agency to advertise, as I said, on bus shelters, bus stops, mobile billboards. We had a mobile billboard at Tandanya for Survival Day, and through Facebook and Instagram carousels, and below the line elements such as the website, journals. We've sponsored the Gladys Elphick Awards. There's a Mighty Mouth Mighty Mouth comic, and we've also finished off some videos that were of health professionals with some of the medical services, and an evaluation of the campaign will be undertaken in June, July of this year. So that's really it. If you have any questions, feel free to ask. Yeah, and that's what the website looks like now. It's been updated for the new campaign imagery.
Wow, some beautiful photos there, Cassie. Absolutely lovely. And they are local people?
Yes. So the ambassadors are dancers, and yeah, they're quite well known in the community. Some of them are part of a dance community, dance school, which is in Alberton, and they teach local Aboriginal kids Nunga ballet and other like hip hop dance and stuff. So they're good positive role models, and I thought that the link between health and not smoking was a great message, as well as that they're all family members together. So yeah, and we tried to go for bright colours, and so we went for like an ochre colour of that, the yellowy mustard colour to grab attention. So yeah.
Cassie and Dora, do you evaluate the effect of the products that are out there? How does that work?
Yeah, so we have the Cancer Council carries out focus testing for us, and they do qualitative and quantitative studies to evaluate the campaign. And so we've got an intercept survey happening April, May of this year to test some of the campaign messaging that's out there. So we have like a few objectives, which is to maintain quitting behaviour, maintain exposure to the campaign prompted and unprompted, and to maintain recall of campaign creative prompted, as well as associated objectives to maintain awareness of the harms of tobacco use of Aboriginal people in the metro area, harms of passive smoking, and then making homes smoke-free and cars smoke-free. So they're the objectives. Yeah.
Deadly.
Well, if anyone...
Hey, Cassie, can I ask a question though?
Yeah, sure.
I guess we're in the situation around funding and I guess future for the campaign. I don't know if you're able to sort of talk to that, and then I guess importantly, sort of if things are winding up, sort of where to from there for the communications and or the page and that sort of thing.
All right. Did you want to speak a bit to that? Because me and Dora are working on a tender process.
Yes. Hi, everyone. I'm Dora Oliva, and I am Senior Policy Officer for the Drug and Alcohol Services in South Australia in the Tobacco Control Unit, and I work with Cassie. And thanks for your question, and thank you for the opportunity to come today and join your meeting. We are really thankful for that opportunity. We believe that the better we partner and we liaise with those working with communities, we will have better outcomes. And this is the purpose of us coming today, and try to understand how the team are working and how we can complement that work. Moving forward, you may be aware that the Aboriginal Health Branch in State Health are commissioning new funding for the Closing the Gap, being smoking one of the elements under the maternal and child health. And so far we understand that the papers will be released. The timeline was probably April, June, but we don't know clearly if those dates are going to be changed because of COVID-19. We anticipate that it may be changes, but we don't know. Officially, there is nothing other than what is on the website for the tender, for the commissioning process. And I believe most of your organizations have been informed. we had, I think some letters were sent to those grant recipients from the SA funding, notifying about the commissioning process. So this is so far what we can indicate. There is no other information, unfortunately, that we can offer. Yeah, but thank you for asking that. We anticipate that at some point things have to, when things come down, processes need to continue in place. And so if there are no other questions, I wanted to, if everyone is happy, yes, no, this presentation is fine, Leslie, thank you. So if that's okay with you, I wanted to talk about the South Australian Tobacco Control Strategy that we will be developing moving forward. I don't know if there are other questions regarding the campaign for Cassie, or can we move to the SA Tobacco Control Strategy? Is everyone okay with that? Yes, okay. So as you may be aware, well, I wanted to start by acknowledging that this land we meet on today is the traditional land of the Kaurna people, and we respect their spiritual relationship with the country. We are also acknowledge that the Kaurna people are the custodians of the Kaurna land, and that their cultural and heritage beliefs are still important to the living Kaurna people today. Thank you for the next slide. So we have at the moment South Australian Tobacco Control Strategy in place. And this strategy is going to end in 2020, so this year. And we are trying to prepare as best as we can a new strategy. So the objective of this presentation is to obtain any feedback that you are willing to share this morning, and particularly around how we can reduce daily smoking prevalence among Aboriginal people. So the current strategy has a goal, and the goal is to improve the health and well-being of South Australians by reducing the impact of tobacco. And the vision is that SA has the lowest rate of smoking in Australia, not only for the general population, but also for high prevalence groups. And under high prevalence groups, we are referring to Aboriginal and Torres Strait Islander people experiencing mental illness, people in disadvantage, and communities in low socioeconomic status or in socioeconomic areas. The next, please. So we have different priority areas under the strategy, 5 to be exact, but I just wanted today to focus on the priority area that is relevant in terms of reducing daily smoking prevalence among Aboriginal people. And we have 5 main activities. So one is delivering targeted social marketing campaigns with Aboriginal communities that meet their needs and reduce smoking prevalence. And we have lead partner agencies. So under that area is SA Health in partnership with Aboriginal Community Control Health Sector, local health networks, and the Cancer Council South Australia. And you may notice that the TEAS program is not mentioned across this area. And this is why we thought it's so important that we reflect that there is government funding towards this area, and it's an important contribution, and we should better reflect that. But of course, I will listen to your views once I finish. I just wanted to bring that up because it's not that we haven't identified that. Is that I think 5 years ago or 6 years ago when this process started, probably the funding was not as strong as it is now, and for a reason I wasn't here by then, so I don't know why that wasn't acknowledged, but certainly it's an opportunity. The number 2 action is support the delivery of Aboriginal community control smoking cessation services. So this is targeted cessation support, and we have leading agencies, SA Health, the Aboriginal Community Control Health Sector in partnership with primary health networks, Cancer Council and local health networks. We have a third activity that is encourage health practitioners to routinely ask Aboriginal people about smoking status, provide advice, and encourage quitting, and a proper follow-up. And I guess there we are looking into, we probably need to add recording if that activity was to stay, a proper recording on that. And there is the state health, Aboriginal community control health sector, also in partnership with primary health networks. Then we have work in partnership with Aboriginal health and community organizations, elders, and communities to decrease smoking prevalence again. And we have SA Health, Aboriginal community control health sector in partnership with local health networks. And activity 5 is support smoke-free pregnancies among Aboriginal women and their families, including assistance to quit smoking. And information about the harms of secondhand smoke. We have SA Health, Aboriginal Health Council of SA, in partnership with Aboriginal community control and primary health networks. Would you like to comment now on those activities, or you want me to finish the presentation?
I reckon just finish the presentation just because we are running a little bit behind schedule. And then if anyone does have any questions, you can pop it in the group chat so that we actually can keep record of it. Is that all right?
Yeah.
Everyone okay with that? Yeah. All right, cool. Keep going.
The next slide is talking about the targets. So we had 2 Aboriginal specific targets on the strategy. Excuse me. One is to do with reduce smoking during pregnancy among Aboriginal women. And back then we had 50.5% in 2012, and the target was to 35 by 2020. Now on this strategy, on this target, I know that the prevalence among Aboriginal pregnant women in SA is 41.6 as of 2017. That tells us that we are not going to meet this target, unfortunately. And probably more needs to be done in this area, including the allocation of funding and more targeted efforts. So it's nothing new, we know this, and we have to continue to innovate and to find ways to really capture this audience and to motivate Aboriginal pregnant women to quit. And I am aware that every one of you are doing a great effort in that space, and it's quite a challenging area. Number 8, which is another Aboriginal specific target, is reduce daily smoking among, smoking prevalence in the Aboriginal population. Back then we said from 42.2 in 2012 to 30% by 2020. Now, reviewing the latest data we have, that prevalence has reduced to 40.4% in 2018-2019. So again, we are not meeting this target. Saying that, I want to acknowledge that this strategy was quite ambitious. Excuse me. So acknowledging that we know that there is a lot of effort and funding towards this area, and we need to continue working hard. We have the lowest prevalence of smoking among Aboriginal and Torres Strait Islander people across the Australian jurisdiction, so that's a good thing. Even though we didn't meet the targets, we probably need to, this is a good time since we are reviewing the strategy and we are developing a new strategy to try to identify what things we do differently, how we can put a new target that has more realistic, a new strategy with more realistic targets. So now the next one is, thanks Kathy. The next one is more the discussion, and this is where we wanted to get your views. But please do not do not feel obliged to comment today. If you wanna think about what things can change on this current strategy, and you want to offer later feedback, that is an opportunity. Or if you have any comments now, we are very thankful for any feedback you would like to offer.
Thanks for that. Is there anybody that would like to ask a couple of questions now? Or we can pop it in the group chat, or I can send Dora and Cassandra's email out later if anyone just wants to have a look and give it a bit of time, then contact them.
Hello, Dora and Cassie. I was interested to hear what teams were thinking about e-cigarettes in general. I know that I think I know that the uptake of e-cigarettes is quite low across Australia, but does that mean that we should be complacent in terms of still, can you hear me all right? Yep. Yeah. Does it mean, should we also be, I guess, including those messages around don't start using them, they're probably not a good option if you're trying to quit. I guess I'm just interested to open up to the other teams, and even to Tom and Penny, about how we get a consistent message around that, and how much investment should we put into e-cigarettes. I think that we should put some investment, but I'm not sure going forward what we should be doing. The kids ask about it all the time. We get lots of questions from community. I've had cases where doctors have told clinic managers that they want to encourage people in remote areas to use e-cigarettes, and we've just said, no, don't do that. Please don't do that. So I guess I'd like to open it up to others for their thoughts.
So, have a go. I was in, Dora, whether you had any stats on the prevalence of e-cigarette use across South Australia, because I think that's
yes. Thank you for
that
bringing
one. And Nara, in relation to your question, that's something that we are through NBPU and through the department because there is a lot of misinformation, and particularly fact sheets for doctors and health professionals. But sorry, Dora, you go.
Oh, sorry for the interruption. I thought you finished with the comment. Thank you for bringing that up. I think it's a very important discussion we had to have. And yeah, the prevalence of e-cigarette use among South Australians is 2%.
So, Nala, can I just add to what Tom has just said, which is, I don't know if you've looked on TISRIC, but we put our stance up there very clearly around e-cigarettes. I mean, the one thing I would say is, I know increasingly there's evidence coming out of places like the UK which suggests, or the way they put forward the evidence they suggest that they're good for smoking cessation. I would argue that actually they're not. There is no evidence for that at all, because often if you read those papers very carefully, what happens is even if people do stop smoking traditional cigarettes, they carry on using e-cigarettes. So they're just shifting from one addiction to another. And I'm not convinced that's helpful, because we don't have enough evidence to show what their harms are. We know there are harms for sure. I think we have plenty of other clean approaches to nicotine replacement, and people should be using those. And let's not forget that it's still actually not a legal thing in Australia.
Yeah, thanks, Penny. And I think that Dr. Maddox might want to just mention some of what what he's been picking up internationally and his last little foray to that got him into self.
Yeah, thanks, Tom. Hi, everyone. Gosh, all right, I won't read the group chat, but I see there's some interesting conversation going on there. It also possibly leads me into one of my questions that I was going to ask when I speak a little bit about the evaluation, and if people are interested in some more specific, regional specific information. I know across the country, when we look at e-cigarette use based on the Aboriginal and Torres Strait Islander Health Survey and other surveys that are now collecting that, we are seeing some uptake, and we're seeing some, I guess, interesting uptake, particularly among young populations, I guess, depending on what survey you're looking at, but 18 to 24 year olds, we're seeing some uptake in the realm of 13-14%. So it sort of varies by age as well. So I think that's useful to know. But again, this is across the country. But if people are interested in that sort of information, then we can do some analysis on that so that we can provide it to you. I guess returning information to community is one of the things that I think we have an opportunity to do. In terms of some of the international literature, I think Penny raised a good point about the policy, and the context is very different in Australia. So when we do see it in the States, and particularly the States, they are advertising very heavily to children. I think they're still doing that in Australia, unfortunately, through social media and other things. So I appreciate the question, particularly about young people taking it up that might not have been smoking anyway. So in terms of as a cessation device, then maybe we're not looking at it as a cessation device anyway. It might be an uptake on something new. I think the other evidence that's interesting is dual use just essentially is resulting in people being exposed to the harms of both tobacco use and e-cigarette use, and not having a benefit either way, but possibly exacerbating or having this sort of synergistic effect of having the harms of both as opposed to just the harms of one product or the other, which is alarming. And then the UK is a very different model. So we actually don't really have a regulated model like the UK at the moment. So that's why I guess my concern is particularly around the normalisation of tobacco use, as well as obviously the harms by that. But yeah, there are lots of other products we can promote before hopefully having to go that. But I understand it's an elephant in the room, and it always comes up. And Tom mentioned I was in the States last week, last week, because I'm still in isolation. So thanks for allowing me to be social today. The other one that's interesting was the US Surgeon General provided very strong evidence to say that there wasn't strong remarks about that, saying there wasn't evidence to support e-cigarettes, the cessation tool. The other thing that I thought he talked about that was interesting was around COVID-19, and I know obviously we're meeting not in person today as a result of that, but I guess he stressed that with that sort of pandemic going on, it's even more reason to support our communities to be smoke-free, and to make sure that we give them the best opportunities to have strong and solid, I guess, respiratory health, including being e-cigarette free, ideally. So I don't know if that's what you wanted me to talk about, Tom, or if there was something else specifically that I might have mentioned before of interest, but happy to go further if people want to ask more questions. And nice to see everyone.
Okay, so there's some really good questions and conversations happening in the chat. So keep that going, because we are keeping record of this. So Dora and Cassie, is that all we have from you guys today? You guys might have to unmute yourself. I can't hear you.
If you could please share the copy of the current strategy with these teams, and if you would like to later on share any additional feedback you would like within the next 2-3 months, that would be welcome. Maybe we can send you a reminder
sure.
closer to the deadline, so that you can provide any additional feedback on how you would like to see the strategy to outline areas to reduce the prevalence among Aboriginal and Torres Strait Islander communities in South Australia. Thank you.
Awesome, thank you. So I'll either myself or someone else from the team will